Let me tell you about a patient. I'll call her Margaret. She was 68 years old, sharp as a tack. She did the crossword puzzle every single morning. She remembered every birthday in her family without ever checking a calendar. Her daughter described her as the human Google of our house. Then, about 18 months after her doctor added a new prescription to her daily routine, her daughter called me in tears. Margaret couldn't remember what she had eaten for breakfast. She was getting confused in the middle of conversations. She got lost driving home from the grocery store she had visited every week for 22 years. Everyone assumed it was Alzheimer's. Everyone assumed it was just age. But it wasn't. It was her medication. And today, I need to talk to you about this, because Margaret is not alone. I have seen this happen more times than I can count in my years of practice, and the most painful part is that most of these patients and their families never made the connection. So if you are over 60 or if you love someone who is, please stay with me for the next few minutes. What I am about to share could genuinely change the course of someone's life. I am a doctor. I have dedicated my career to understanding how the aging brain works, and more importantly, how we can protect it. And one of the things that keeps me up at night is how many people are unknowingly taking medications that are quietly, gradually stealing their memory. Now, I want to be very clear before we go any further. I am not here to tell you to stop taking your medications. Please, do not do that. What I am here to do is make sure you are informed. Because you deserve to walk into your doctor's office knowing the right questions to ask. You deserve to be an active participant in your own health. So let's talk about the 9 medications that every person over 60 needs to know about. The first one is probably sitting in your medicine cabinet right now. In fact, I would bet that most of you have used it in the last 6 months. It is one of the most common over-the-counter sleep aids and allergy medications in the world. I am talking about diphenhydramine. You probably know it better by the brand names Benadryl, Zizquil, Unisom. Here is what most people do not know. Diphenhydramine belongs to a class of drugs called anticholinergics. These medications work by blocking a neurotransmitter in your brain called acetylcholine. Now, acetylcholine is absolutely critical for memory and learning. It is the same neurotransmitter that is severely depleted in patients with Alzheimer's disease. So when you take a drug that blocks it, even temporarily, you are essentially mimicking some of the same chemical changes that happen in dementia. In younger people, the brain bounces back fairly quickly, but after 60, the brain's ability to recover from this kind of chemical disruption slows down significantly. A study published in JAMA Internal Medicine followed thousands of patients over several years and found that people who used anticholinergic drugs regularly had a significantly higher risk of developing dementia, and the risk increased with the cumulative dose. Meaning the more you took and the longer you took it, the higher your risk. Margaret, by the way, had been taking a sleep aid containing diphenhydramine every night for nearly 2 years. Her doctor, who prescribed her new medication, never thought to ask about her over-the-counter habits, and she never thought to mention it. Why would she? It was just a sleep aid. You can buy it at any pharmacy without a prescription. This is exactly the kind of gap that I am trying to close today. Now let's move to the second medication, and this one surprises people every single time I bring it up. We are talking about bladder medications. Specifically, the class of drugs used to treat overactive bladder, medications like oxybutynin, tolterodine, and sulfasenacin. Brand names you might recognize include ditropan and Detrol. These are extremely commonly prescribed to older adults, and I completely understand why. Overactive bladder is a real and genuinely disruptive condition. It affects quality of life in a serious way, but here is the problem. These medications are also strongly anticholinergic. In fact, oxybutynin is one of the most potent anticholinergic drugs in common use. Multiple large studies have now confirmed that regular use of these bladder medications is associated with a measurably increased risk of cognitive decline. One study out of the University of Nottingham tracked over 280,000 patients and found a clear dose-dependent relationship. The more anticholinergic medication a person had been exposed to over their lifetime, the greater their risk of dementia. If you are currently taking a bladder medication, please do not panic. There are newer options that work differently with far less impact on the brain, but you need to have that conversation with your doctor. Tell them you have heard about the anticholinergic burden and you want to discuss alternatives. Those 3 words, anticholinergic burden, write them down if you need to. They could open a very important door. The third medication on our list is one that genuinely breaks my heart to talk about because the people who need it most are often the most vulnerable. I am talking about benzodiazepines, drugs like diazepam, lorazepam, alprazolam, and clonazepam, Valium, Ativan, Xanax, Klonopin. These are some of the most widely prescribed medications in the world, used for anxiety, panic disorder, insomnia, and muscle spasms. And I understand the relief they bring. When someone is living with debilitating anxiety, these medications can feel like a lifeline. But the research on long-term benzodiazepine use in older adults is deeply concerning. A landmark study published in the British Medical Journal found that people over 65 who had used benzodiazepines for 3 months or more had a 51% increased risk of developing Alzheimer's disease. The longer the use, the higher the risk. What benzodiazepines do is essentially sedate the brain. They enhance the effect of a neurotransmitter called GABA, which slows down brain activity. In the short term, this is what creates the calming effect. But over time, in an aging brain, this persistent suppression of neural activity appears to accelerate the very cognitive changes we associate with dementia. And here is the tragedy. Many older adults who start on benzodiazepines are never properly tapered off. The medication that was meant to be a short-term bridge becomes a permanent fixture. Years go by, and the cognitive decline that follows is often attributed to aging rather than to the drug. If you are on a benzodiazepine, particularly if you have been on it for more than a few weeks, please talk to your doctor about a supervised tapering plan. I want to emphasize the word supervised. You should never stop these medications abruptly. It can be dangerous, but a gradual, carefully managed reduction, combined with behavioral strategies for managing anxiety, can make an enormous difference. Now, the fourth medication. This one is going to surprise many of you because it is associated with heart health, and we tend to think of heart medications as protective. I am talking about certain beta blockers, and more specifically, the lipophilic ones, drugs like propranolol and metoprolol. These medications are fat-soluble, which means they cross the blood-brain barrier more easily than other beta blockers. The evidence here is more nuanced than with the previous medications, and I want to be careful not to overstate it. Beta blockers are genuinely important medications for millions of people with heart conditions. But there is a growing body of research suggesting that lipophilic beta blockers, particularly at higher doses and over long periods, may contribute to cognitive changes in older adults. Some patients report what they describe as mental fog, slower thinking, and memory lapses. If you are on a beta blocker and you have noticed cognitive changes, ask your cardiologist whether a hydrophilic beta blocker, one that does not cross the blood-brain barrier as readily, might be an appropriate alternative for your specific condition. Again, do not make any changes on your own, but do ask the question. The fifth medication is proton pump inhibitors, commonly known as PPIs. You know these as omeprazole, esomeprazole, lansoprazole, Prilosec, Nexium, Prevacid. These are among the best-selling drugs on the planet used to treat acid reflux and gastroesophageal reflux disease. Here is the connection to brain health that most people never hear about. PPIs reduce your stomach's ability to absorb certain nutrients, in particular vitamin B12 and magnesium, and both of these are critically important for brain function. Vitamin B12 deficiency is actually one of the most underdiagnosed causes of cognitive symptoms in older adults. It can cause memory loss, confusion, and even symptoms that closely mimic Alzheimer's disease. And because B12 deficiency develops slowly, the symptoms tend to creep up over months and years, making the connection easy to miss. Beyond the nutrient deficiency issue, some research has also suggested a more direct link between long-term PPI use and dementia risk, though the mechanisms are still being studied. A large German study published in JAMA Neurology found a significant association between regular PPI use and increased dementia risk in older adults. If you have been on a PPI for more than a few months, ask your doctor to check your B12 levels. This is a simple blood test, and ask whether you still need to be on the medication at all. Many people are kept on PPIs far longer than necessary. Now we come to number 6, and this is one that I think is profoundly underappreciated. Prescription sleep medications, not the over-the-counter diphenhydramine I mentioned earlier, but the heavier prescription drugs. I am talking about zolpidem, which most people know as Ambien, as well as isoprolol and Zaloplan. Sleep problems are extraordinarily common in people over 60, and I have enormous compassion for anyone who has struggled with chronic insomnia. The exhaustion is real. The desperation for rest is real. But here is what I need you to understand about these medications. They work by binding to the same receptors in the brain as benzodiazepines, and they carry many of the same long-term risks. Studies have linked chronic use of prescription sleep aids to increased risk of dementia, falls and fractures, and residual next-day cognitive impairment. In fact, some research suggests that the impairment these drugs cause in the morning, that groggy, foggy feeling, is actually a sign of how significantly they have disrupted normal brain function overnight. Good sleep is one of the most powerful protectors of brain health we know of. The brain clears metabolic waste, including the amyloid proteins associated with Alzheimer's, during deep sleep. The terrible irony is that prescription sleep aids, while they may help you fall asleep, often disrupt the deep restorative sleep stages that the brain needs most. So you may be sleeping more but actually getting less of the brain protective benefit. I am not saying never use these medications. In some situations, short-term use is appropriate, but long-term nightly use in someone over 60 deserves a very serious conversation with your doctor. Number 7 is one that many of my patients find truly shocking when I tell them. We are talking about certain antidepressants, specifically the older tricyclic antidepressants, drugs like amitriptyline, nortriptyline, and imipramine. These are sometimes prescribed not just for depression, but for nerve pain, migraines, and sleep problems. Like diphenhydramine and the bladder medications, tricyclic antidepressants are strongly anticholinergic. They add significantly to what researchers call the total anticholinergic burden, the cumulative load of acetylcholine blocking activity that your brain is dealing with at any given time. And the research is clear that a high anticholinergic burden is one of the most significant modifiable risk factors for dementia that we know of. Many newer antidepressants, the SSRIs and SNRIs, have a much lower anticholinergic profile and may be safer options for older adults. If you are currently on an older tricyclic antidepressant, this is absolutely worth discussing with your prescribing physician. Now, number 8. This one relates to something that is increasingly common and increasingly important as our population ages. I am talking about corticosteroids, drugs like prednisone and methylprednisolone, used to treat inflammation in conditions ranging from arthritis to asthma to autoimmune diseases. Short-term steroid use is generally not the concern here. The issue is prolonged use. Long-term corticosteroid therapy has been associated with changes in brain structure, particularly in the hippocampus, the region of the brain most critical for forming new memories and one of the first areas damaged in Alzheimer's disease. Steroids can also cause significant mood changes and cognitive symptoms, even in the short term, a phenomenon sometimes called steroid psychosis. If you are on long-term steroid therapy, your doctor should be monitoring you closely for cognitive changes. And if alternatives exist, disease-modifying medications that can reduce your dependence on steroids, they are worth exploring. And finally, number 9. This last one is particularly important because it sits at the intersection of a condition that is already a risk factor for dementia. I am talking about certain medications used to manage blood pressure, specifically some of the older first-generation antihistamines that are sometimes still used off-label, and also the centrally acting antihypertensives like methyldopa and clonidine. Clonidine and methyldopa work by acting directly on receptors in the brain to lower blood pressure. And while controlling blood pressure is genuinely important for brain health, high blood pressure is itself a major dementia risk factor. These particular medications can cause significant sedation and cognitive side effects in older adults. There are many newer blood pressure medications that effectively control hypertension without these central nervous system effects, and for most older adults, they are preferable options. So we have gone through all 9. And I imagine some of you are sitting there feeling worried, maybe even overwhelmed. I understand that. When I lay this out for patients in my office, the first reaction is often fear, but I want you to hear what I say to them. Knowledge is not a reason for fear. Knowledge is a reason for action. Here is what I want you to do. I want you to write down the name of every medication you are currently taking, prescription and over-the-counter, every single one, including the sleep aids, the antacids, the allergy pills, everything. Then I want you to make an appointment with your doctor and ask for a comprehensive medication review. Tell them you want to discuss the anticholinergic burden of your current regimen. Tell them you want to understand the long-term cognitive effects of each medication you are on. A good doctor will welcome this conversation. If yours does not, that in itself is important information. I also want you to remember Margaret, because the story does not end with that phone call from her daughter. When I reviewed her full medication list, including that over-the-counter sleep aid she had never thought to mention, and we made some careful adjustments, she got better. It took several months. It was not instant. But the sharp, warm, extraordinary woman her family knew began to come back. Her daughter called me again about 8 months later. This time she was not crying. She said, "Mom remembered my daughter's first word today. She brought it up completely out of nowhere. I just want you to know that. That is why I do this work. Your brain is not simply a passive victim of aging. It is a dynamic, responsive, remarkably resilient organ. And when we remove the obstacles that are silently working against it, it can recover in ways that will astonish you. Please share this with someone you love who is over 60, not to frighten them, but because they deserve to know. They deserve to ask the questions. They deserve the chance that Margaret got. Thank you for spending this time with me today. Take care of yourselves and take care of your brain, because everything you are, everything you love, every memory that makes you who you are, lives there.